Dietitians at Swan Hill District Health work across a range of different areas. So one of my roles is I actually work on the acute ward with the patients there. I also work at the aged care at Logan Lodge, and I also do some outpatients as well. So you'd be seeing people from the community who come in just as you would at a doctor's clinic as well. I think it would be good to be passionate about nutrition, as this is your job basically, so that's what you're going to be talking about and working with all day. We do healthy eating and we do speak to people about healthy eating, but we also make sure that our patients on the ward are nourished and they're not losing weight as well, because we know that when we are losing weight as an inpatient in the hospital, it does impact our recovery, and it means we can stay in hospital for a longer amount of time as well. So we're working with patients on the ward and really making sure that they're eating enough food, and if they've got higher energy requirements and stuff like that, we might pop them on special diets or pop them on special supplements as well, special drinks. We also work with people in the community who might have type 1 diabetes or type 2 diabetes, other chronic medical conditions as well. We also work with people who want some advice about healthy eating. Our typical day will look like I will start off in the dietetics department and I'll do a quick handover of the acute ward. So this is really helpful for me to discuss any patients that I'm having trouble with, or just to talk over my plan, as there's only one dietitian on the ward each day. So it's good time to touch base with everyone about that. Next thing that I would do would have an allied health meeting on the ward, and that will be discussed with all the different teams, so OT, speech, you've got nurse in charge as well, social work, physio, and a few others as well, and we talk about the different patients who are on the ward and what's going on there. And then from there, I will then speak to my allied health assistant, Ella, and I'll flag with her any patients that I think should be screened for malnutrition who might need to be seen by me as well while they're on the ward. And then from then on, it's just planning about my day, seeing who's most important to see on the ward, patient-wise, and then just seeing them as I can throughout the day. The steps that I would recommend someone to take if they were wanting to study dietetics would be to study a health science or a nutrition degree in university. So you do need a university qualification to become a dietitian in Australia. There is no undergraduate dietetics degree in Victoria, but there are in other states in Australia. So you will need to do an undergraduate degree to then study the masters if that's what you're wanting to do in Victoria. The skills, qualities or attributes which would be helpful when thinking about becoming a dietitian would be having those good people skills. So whether that's getting some experience at an outside job as well as when you're studying, or thinking about what you want to do, whether that's in retail or hospitality, just getting that communication up to speed as well, because you will be speaking with people quite a lot, and you really want to be able to get on their level as such, as well as being flexible. Being able to work under pressure as well is quite important, as well as knowing your limits and knowing when to ask for help as well. The challenges that I face as a dietitian, I guess every day is different, especially when you're working on the acute ward. You don't know what you're walking into each day, and we don't have specialist dietitians here as well, so you work with a lot of different medical conditions, so you kind of have to think on your feet sometimes and do some quick research before you see someone. I think as well, one of the challenges can be when you're working with those patients who are at their end of life stage as well. It's a bit different to switch from wanting to nourish someone to then keeping them comfortable as well. So that's a little bit challenging, but you're still quite an important person to them at that time as well.